You probably know someone who has had hip replacement surgery. It's a common operation that has become much more common in recent years as our population ages. In 2000, fewer than 140,000 total hip replacements were performed in the United States. Today, that number is more than 330,000. Only about 15 to 20% of those surgeries employ what's called the anterior approach. At Phoebe, one of our highly trained orthopedic surgeons, Dr. Ani Uyo, specializes in this method. The anterior approach allows the surgeon to make the incision in the front of the hip rather than the side or the back, as with traditional hip replacements. We have a special operating table that allows Dr. Uyo easy access to the front of the hip. This approach has many benefits. The incision is smaller, so the surgery is less invasive and there is less muscle trauma. After surgery, patients generally feel less pain, have quicker and easier recoveries, and shorter hospital stays. Now, this approach isn't right for every patient, but it is an outstanding option for many people who need a hip replacement, and Dr. Uyo will help each patient evaluate all treatment options and come to the decision that is right for him or her. It's another way Phoebe is working to provide the most advanced services and the best care to the people of Southwest Georgia.